Thanks, Ceann Comhairle. Taoiseach, I want to bring up again the HICWA report into the overcrowding at the ED at UHL. There are 88 patients on trolleys today, the same number as on the 15th of March when HICWA carried out the report. UHL needs serious help from a national level. We have the second highest number of throughput of ED patients, yet we have the lowest number of relative ED of acute beds. That's a very important statistic. So what I'm asking, Minister, is the Minister for Health has set up and asked the HSE to put an expert team in there. We need to see that they concluded their review on the 10th of June. We need to see, Taoiseach, that the HSE corporate will now step in and help UHL. It needs help.
Time is up.
And I need you, as Taoiseach, to very much stand behind that proposition, and that these measures, action plan, will be now brought forward by the review team and the HSE nationally to be implemented immediately in UHL. Taoiseach. Very hard-working staff, but we have serious problems there, Taoiseach.
Well, first of all, my understanding, the HSE have been involved at national level in terms of the governance and have sent a team into the hospital to monitor and review. So that has happened. And are acutely aware of the challenges and pressures on the hospital. And the HICWA report identified, for example, that even though a very substantial increase in beds happened in the last number of years, that did not in itself alleviate the pressures on the emergency department. So there are issues other than resources, and I do think more resources will be required in terms of acute beds, but that will take time. In the interim, issues in terms of the systems within the hospital flow through the hospital. And as I said earlier, when the HICWA report was carried out, it was at the high point of disruption caused by COVID-19 as well. It was an unannounced visit, it's the same thing. So one can understand. And I think COVID is having an impact on health. Everyone wants to forget about it and pretend it's not happening. But it is happening, and it's having a significant impact on the operation of hospitals.
I'm very